It is the deepest gratitude and love anyone could feel towards a perfect stranger.
I knew somebody had to pass it along, definitely out of love, for me to be able to receive that at that particular moment.
And these patients want the world to know how important it is to consider organ donation.
I think everybody in America should be a registered organ donor. It's that important.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart and our week of love in honor of Valentine's Day, which is tomorrow. Today, so much love and gratitude after the greatest gift anyone could ever receive, the gift of a heart. This week, patients Archie Moore and Brian Pitts are celebrating their third Valentine's Day with their new hearts.
I said this feeling of gratitude has come over me that is so overwhelming. I don't know what to do with it. And I could feel it coming into me and actually flowing out to other people. And the nurses would come in and the doctors would come in, and I'd express that to them. And it was almost palatable. It was amazing.
Here in the studio, we are so happy to be joined by heart transplant recipient Brian Pitts, cardiothoracic surgeon Dr. Tyler Zorn, and Jan Caldwell, who is a nurse practitioner on the advanced heart failure team. Thank you all for being here. And unfortunately, Archie Moore can't join us this morning because the family member she relies on to be able to join us is under the weather, like so many people right now. Everyone knows someone who's super sick. Archie's fine, but she needs to stay far away from anyone who is sick because she can't get sick. So we hope Archie's family member feels better. Brian, I want to start with you. You were feeling great and so positive after your heart transplant, but recently you hit a little bit of a rough patch. You developed something called cardiovascular vasculopathy, which is also known as CAV, much easier to say. What is CAV as you understand it?
So it's a unique to heart transplant recipients form of, what's the word I'm looking for? Coronary artery disease, basically, a thickening of the coronary arteries. We all get it to some extent, and some of us progress quickly. At my 1-year calf, they said, we see a little bit, not too worried about it. But in my 2-year, I was a 3 out of 3, which was pretty severe. They changed my medications around, put me on an injectable medication, and I'll know hopefully in April whether we've halted that or reversed it.
And we're going to get more to the transplant in just a bit with Dr. Zorn, but Jan, I do want to ask you a couple of questions about CAV because you know a lot about it. Is developing CAV rare?
Actually, no. It's quite common in our transplant hearts. We know that in the first year post-transplant, 1 out of 8 patients has about 1% of, 1 out of 8 person in the first year will develop it. And then moving on, when you get to the 5-year mark, about 49% of patients have CAV.
And then what does that mean for the future of the new heart?
So on the early days post-transplant, when I'm seeing patients in clinic, we spend a lot of time talking about what's your blood pressure, how's your diabetes, how are your blood sugars, how are your cholesterol numbers, because all of those factors play into the development of this disease. So we try to be very aggressive early on with lifestyle risk factor modification. And then down the road, if we need to, as Brian just said, we have to adjust medications, immunosuppressions, things like that.
And Brian, you were feeling pretty discouraged. In fact, you were feeling so low you almost didn't join the program.
Yeah, I am heavily involved in mentorship, and over the past 3 years, almost immediately out of transplant, I began mentorship, talking with other transplant patients that were waiting, going through, or post-transplant. And over the 3 years, I've lost a couple people, and seeing the kind of uglier side of the miracle, I don't know if I'd say it jaded me, but it just kind of broke me for a little while. One woman in particular, Sabrina, I talked to her the night before transplant, and she had a stroke during transplant and she died. And it kind of ruined me. And I felt my gratitude just kind of wither up and die. And I felt like at that moment I couldn't really mentor people. I wasn't in a good headspace. I wasn't able to provide the positivity and the bright outlook that they needed. And right at the right time, I got a letter from my donor, from his mother.
From your donor's mom,
Yeah.
because you had texted me saying, I can't do it, I'm so sorry.
Yeah. And then about
3 days later,
Yeah.
you texted me and said something amazing happened.
Yep, I got the letter, and man, I just cried and cried and cried. And knowing who my hero is, whose heart is in my chest, changed everything. You know, it makes it even more real, being able to see a picture and have a name, and my gratitude just came right back.
And we're not going to say the name on the air because we don't have the permission from the donor family at this time. But there was someone else in that picture with your donor.
Yeah, he was a 27-year-old young man from Illinois, and he had a son.
Like a little boy.
Little boy, yeah. Yep. So his mom, Jennifer, wrote me and told me all about him, and some of the things we had in common were uncanny, just really amazing. So immediately I felt my gratitude return. And the very next day I had a friend who's had a heart attack. He was in a support group for that at North Kansas City Medical, and he said, I've got a friend in Texas that needs a heart transplant. Will you talk to him? And I picked up right where I left off.
I've heard those moments because it came just at the time.
Yep.
I've heard those moments described as God winks.
Yeah.
For whatever your belief system, it is wild that those things happen at just the time you need them.
It's even weirder than we've even talked about. I had heard on some of the Facebook pages, you know, maybe reach out to your transplant center and just find out for sure that if you've written a letter that the family's received it. And I did just that. I wrote to the Midwest Transplant Network and I said, could you just verify that they got my letters? I've written 3 over 3 years. And she emailed me back the next day and she said, I think I have a letter for you. And I said, you're kidding. And so there was some chasing around trying to find out where this letter is.
Yeah.
And then she calls me back and she says, Brian, the transplant center from Illinois mailed it to you directly. We'd had that big snowstorm and I hadn't checked my mail for about a week.
Oh, wow.
It was in my mailbox.
Oh my gosh.
Yeah. That, and just like you said, one of those little God winks.
Yeah.
Right at the right time.
Dr. Zorn, how common is it for donor families to reach out to the recipient?
I don't know the percentages. I'm willing to bet that it's more common for the recipient families to reach out to the donor families.
Right.
Just because they are trying to show gratitude for this gift of life that they've been given. But I don't think it's uncommon at all for the donor families to want to know what happened to their loved ones'
Who got the
organs
heart.
and how they're doing. And,
Yeah. And how much do you learn, Dr. Zorn, about each donor before that heart goes into your patient? Do you know a lot of information that you can't share with the patient?
There's a lot of information we can't share with the patient, and we know a tremendous deal because we have to learn whether or not these organs are right for our recipients. And so we learn the story about why they're admitted to the hospital, what happened to them, and then learn about each of their organ systems, what's working and what's not, and ultimately what organ we are looking at in determining the best fit for our recipient here.
That's incredible. And Brian, I mean, obviously we can see it in your eyes underneath that amazing hat you've got on, that it's so powerful. Now you have an actual person to place with the heart that's beating in your chest.
Right. Yeah.
Did you put that picture somewhere in your house?
Oh yeah,
special?
yeah. It's next to my chair where I sit. You know, every morning I have coffee, and you know, I talk to him. You know, I know who he is now, and I talked to him before, but now knowing who he is and what he looks like, and some things about his life, you know, I can address him and say, hey, you know, this is what's going on today, and I need some help, or I need some of your strength.
Wow.
It's powerful. Yeah.
Have you developed any kind of back and forth with your donor's mom? Did you?
I just actually sat down and wrote my reply yesterday. It had been about 3 weeks since I got the letter, and yesterday felt right, and I sat down to do it. They're not easy letters to write, but this one just kind of flowed out of me, and it was, you know, filled with gratitude again, and thank you for everything, and thank you for excuse me, I can't say his name, and just how better things are now knowing what I know.
Yeah.
Yeah, it's very impactful.
We already have some questions and some comments and messages coming in. If you have a question for us on the panel, just send it on YouTube, Facebook, or the All Things Heart email. We will connect with you in real time during the program. All those links are right there on your screen. Now, throughout the time of knowing Brian and our other recipient, Archie, who was supposed to join us today, both of you have been so clear in recognizing that this big gift came also with a deep sadness for another family. And when we spoke with Archie, it was just a couple of days after her transplant, and that was one of the first things that she wanted to talk to us about.
I felt overjoyed for one, and then I kind of went to the other end and felt sad because I knew somebody had died to have this privilege to get this heart. I didn't know the circumstances, but I knew somebody had to pass it along, definitely out of love, for me to be able to receive that. So I'm still laid out all over the place with emotions.
Understandable, and Brian, you say the same thing. Jan, how do you help patients deal with such a complicated array of feelings?
Well, it's not easy. We'll start there. I think early after transplant, we get a lot of mixed emotions. Patients are on a lot of prednisone, which can make people angry or tearful, so we have all spectrums. But what we talk a lot about is basically when you have heart failure, you have this set of problems that we get rid of when we move to transplant, but that comes with a new set of problems. So I try to discuss that with patients so that they can kind of wrap their head around that and work through some of these emotions that Brian has experienced.
Now, Dr. Zorn, you're in the surgery room, taking out the heart, putting in the heart. How often do you get to see it through to the end for the emotional journey? How common is it that you develop this kind of knowing, like with a patient like Brian?
We, from the surgical perspective, we don't see as much of the longevity that Jan or some of my other colleagues deal with, because they follow these patients for the rest of their lives, and we get to see them, through the initial hospital stay and as they get readmitted from time to time, but don't always share that unique bond with these patients. So I am jealous of that from time to time. Not jealous other times, but
yeah.
It's a special experience because these patients become family to our health system, and there are a lot of special relationships formed.
And that's, Jan, you develop such close relationships with the patients. Yeah. Are there counseling services available through the health system?
Yes, there are. So as part of the initial transplant evaluation, everybody is seen by psychiatry, and if there are any things identified, then that can try to be addressed prior to transplant. But then after transplant, we have a clinical psychologist that works with our patients, and I very frequently, especially in the early days post-transplant, try to get patients to start meeting with her to just try to, again, wrap your head around everything.
Right.
So,
did you have to take advantage of those?
I haven't, and honestly, I probably should. Yeah, even 3 years out, things still come to light and these feelings surface, and I never would have expected, almost 3 years out, that things would continue to unfold before me. And it can be a revelation or just kind of a backpedal thought. Having continuing health issues, you're not better. Like Jan said, you've exchanged one problem for another. And when you do have setbacks like my CMV diagnosis, or CAV, excuse me, it can be very impactful emotionally. Sure. Yeah. You've gone through a trauma, and it continues. It doesn't really go away.
You got your life, and now you've got to fight the next battle.
Right.
Dr. Zorn, what guidelines do you follow? You mentioned that you have to make sure that the heart that comes in is the right heart. What do you mean by that?
Well, there's a multitude of factors that we look at when determining whether or not one donor heart is okay for our recipient. You know, one is just taking into account where the donor heart is it acceptable distance away from our recipient center.
Like the physical distance on the map.
Correct.
Right.
You know, one's the size of the donor, but also just looking at what is the function, what does the heart look like, how are the valves working, you know, what are the blood vessels that that supply the heart look like? Because if you put in, you know, a heart that already has diseased blood vessels in the first place, it puts them patients at even higher risk for CAV and other issues. And so we have to accurately match donors and recipients all the time. And
excuse me,
No,
is it possible that you could get a heart that you say, okay, this won't work for Brian, but then it might work for the next guy or the next gal?
Absolutely.
Okay, so it has to be
that
perfect.
Happens all the time.
It's interesting.
Yes, so when we get a offer in, it's our recipients are sequenced out, and so we get those in order. Now it may not be, KU may not get each of the patients, you know, back to back to back, but it may go to one recipient and then come back to us if we decline it for that recipient for another one of our recipients on the list who may be a little bit smaller, doesn't need that big of a heart, you know, and so if the size match is better or just makes sense from an age standpoint, be better. But
Interesting.
Yeah.
We know that we are getting some questions from our viewers. Angie Racono is standing by with those questions. Good morning, Angie.
Hey, good morning. I'm going to start with a comment. This is wonderful. So Christy O'Day Bruner just messaged, husband received donor heart placed by Dr. Zorn, March 2023, and he's doing amazing. This was absolutely the one thing I could not pray for, knowing another person had to pass to get it. But she says that she sees Jan on the follow-ups and that she is great. So I just wanted to share that because I do think that's a complicated thing that everybody deals with when you're dealing with a heart transplant.
Dr. Zorn, you want to respond to that?
I mean,
She's watching.
That's the long-term follow-up that I love to hear, that patients are doing well, back in the community, doing what they love.
You have a message for Chrissy?
I mean, just keep enjoying day to day, and you know, I think it's important and powerful to understand the gift that has been given and use that in your day to day to keep moving forward and appreciate all that you have.
What a great message, Angie.
I know, isn't that wonderful? Okay, Ruth Ellen has a question. It must also be emotional for the healthcare worker to follow the transplant patient. What supports are, I think she's saying, what supports are in place for the healthcare support? Maybe like, what do you guys do to take care of yourselves? Because this is an emotional journey.
Jan, I want to take that to you first, because I've seen you tear up a little bit when you talk about your patients.
Well, I've always been one of those nurses who's a crier. And it's kind of embarrassing, but that's just who I am.
Never be embarrassed for showing your emotions.
So, no, it's a great question because, you know, we care a lot about our patients, and when you see bad things happening, it's upsetting, and we can't control everything. As far as her question about what resources we do, we have, first of all, we have each other. We're a very tight team, I think, so we help to decompress a lot, but we also have some professional counseling services available for all providers as well. So that's a good resource to tap into.
Dr. Zorn, is it hard for you to separate emotionally when you come home after a night of transplanting hearts?
Yeah, absolutely. I think your family has to realize what you do from time to time. A lot of times it's easy, but there are days where it's incredibly hard. Like Jan says, when bad things happen, you can't always separate it. It's
right.
And you carry that home, and you carry that in your day to day. And I think it's important because I think when you stop being affected by that, I think you kind of lose value in who you are as a provider to other patients.
And that's what makes the magic between, I think, from hearing so many patient stories, the patients and their doctors and their nurses, is this connection that we feel every time we have a patient on with their caregivers. We can feel that connection, which is the bedside manner that everyone talks about and they want. And because you're so compassionate, I think it makes for that bond. Angie?
KU has a great team.
Yeah. Angie,
yeah, we have a lot of great questions. Let me ask another one, and I learned about this yesterday myself. Nancy asks, did either Archie or Brian, and so we'll leave it up to Brian to answer this, notice any changes in personality or food cravings after getting someone else's heart?
That's a great question.
I think the biggest one is probably, I'm already a very empathetic person pre-transplant, but it probably tenfold now. I can pick up people's energy very easily. I don't even have to be around the particular person. If I'm close with that person, I can kind of sense what's going on with them. And I think that's really my guy. He's got his foot in the crack of the door, and I have some kind of connection. Transplant changes us, though. It's like I said earlier, it's traumatic. And going through the entire process as you heal and have these revelations, it just changes your appreciation for life. For me, it really has impacted my view on relationships with people and how important they are and how you really have to nurture them. And the ones that really matter, you really take care of and develop, further those relationships. I can't do small talk anymore. And when I see strangers on the street, how you doing today? So engaging with people is much more important. And I realize it's that communal energy of the universe that connects us all.
When you say how are you doing, you mean it.
Yeah.
You actually want to know how are you doing.
Yeah.
Angie, any more?
Yes, we've got, I'll skip down to this one because I do think for a lot of people at home, they might be curious about this. Leslie wants to know, how long can someone with advanced heart failure wait for a heart transplant?
I can take that one. It's different for everybody, and how sick they are when they show up to see us. Some people are very sick or in the hospital and in acute heart failure and dying because of it, and other people are more in a chronic heart failure where their heart is just not well enough to sustain them from day to day, and so people can wait on the heart transplant wait list for years, before they have a heart. But patients that come in sicker, get prioritized, and so they don't wait on the list as long, certainly. So
we want to get to some final thoughts from our guests, but first I want to go to Brian, because you have really thrown yourself into being an advocate for organ donation, so much so that you've really dedicated your life's work to that now, and you have some props. So I want you to show us what you brought, what's in front of you and what's on your head, and then I want you to talk a little bit about, if you could share with us, what you do to advocate for organ donation.
Sure. So, yeah, of course, I yell from the rafters, everyone should be an organ donor for sure. There's no reason not to, really. But I do a lot of mentorship. I've probably mentored a couple of dozen people through the process.
You painted your truck green, right?
Yeah, my Jeep is bright green. It's that mojito green Jeep. It says Donate Life on it.
Here we go.
The Donate Life, stickers
so cool.
and license plate. That it gets recognized. I've had moms walk up to me in the grocery store parking lot and hug me. And she's going, oh my God, my aunt or my son or somebody I know was a recipient or a donor, and it just gets conversation started. So it's important. I'm a part of the KU group, and it's all voluntary. If you want to be part of it, you can be or not. But it's a message chat group on Facebook, and we encourage all recipients to join that group. But we all get together as a group and we chip in money, and we have these shirts produced. And so for everybody that gets a heart transplant,
cool.
They get a shirt. And so I have these made, and I give them to Jan or to Clinton, one of the coordinators.
So that's for the
and they pass them out. Yeah, so this is for number 248.
Okay.
And we all get one. I've got a couple of them myself. But it really, they give them to you during one of your office visits. And it really makes you not feel alone. You're part of a pretty good sized group. You know, it's a very exclusive club, I like to say.
Do you guys hang out? Do you develop friendships?
Yeah, we do. We do develop friendships for sure. And I mean, we've got number one, KU number one guy. He's there all the way out to the last transplantee. I think we're approaching 300. I think, which is mind-boggling. I was number 159. Almost 3 years ago. So yeah, we have an annual picnic, and I'm trying to organize some more events throughout the year, maybe smaller events that we can get together. There's kind of cliques, so there's like a group in Wichita, and then us up here in Kansas City, but there's also a lot of outlying further, people in further communities.
Tell us about your hat.
So the hat, I love my cowboy hat, and I've got a couple of them. And really, why the hat thing started is, they say we are more prone to skin cancers.
Oh, okay.
And so,
after a heart transplant?
Right.
Why is that?
We're immune suppressed, and the skin just can't really shed those cells that might become, cancerous. Not uncommon to have carcinomas taken off your face and stuff.
Interesting.
So I told my wife that's an excuse for me to get cool hats.
Yeah, and you have some bling on it.
Yes. So my daughter, she got me this. It's a little metal heart right here.
Aww.
And it was a pendant, and I said, man, I can't wear that thing because it's big and it bangs on my chest, and the sternum's a little sensitive.
Yeah.
So I tied it to my hat.
I like it, next to the feather in your cap.
Yep.
Thank you so much for sharing and sharing that message of the importance of organ donation. Is there anything else you'd want to say, just in case your donor's mom watches this online?
Oh boy. I can't express enough gratitude anymore. What was once gone came flooding back, and I knew it was there. I just needed to rekindle. When you mentor these people, you build relationships. Some of these people I've talked for 2 or 3 years. Like I said, they're waiting on the list, and we don't talk every day, but we talk regularly, and you get to know them, and you build those friendships, and you know a lot about them, and you share a lot about yourself. So when things go great, it's beautiful and it's a miracle. And I'm very good friends with some beautiful ladies that were transplanted here who've gone on to do more mentorship. And then when you lose somebody, it's heartbreaking. And I didn't expect that. And so certainly some of that survivor guilt weighed in on me with my guy. And I try to convey that in my letter I wrote her yesterday, just how grateful I am and how thankful. And I think I'd be great friends with him.
Oh, that's nice. That's real sweet. Jan, what would you like our viewers to know?
I just think it's really important to have some of these difficult conversations about considering if you'd want to be a donor or not before it's in the time of crisis. Because I think if it's already been discussed and you know what your family member wants before we're having horrible things happen, you feel better about making that decision.
Dr. Zorn.
No, I mean, this has been great. Thanks for having me today. But just so happy to be a part of this side of things where we can really express the gratitude for the donors that give so much and the families of those donors. And so it's an amazing place to work, and we'll keep doing it every day.
You're doing amazing things, and what really is interesting about the cardiothoracic surgeons is that you're like, oh, well, we're just doing our jobs, do it every day. I don't think that's how Brian would describe what you do, or how Brian would describe what Jan does. She just come to work, do my job. Right, very different perspectives. So thank you for doing what you do. Jan, thank you so much.
Of course.
The bond you have and the care you give your patients is incredible. And Brian, I'm so glad that you got that letter and that you decided to join us, because your message is so important.
Thank you.
Thank you. Thank you to our viewers for joining the conversation today. And if you'd like to watch or share any of our previous episodes, just scan the QR code on your screen right now. It will take you to links of all of our past episodes. coming up next week on All Things Heart. For Richard Purvis, aging brought a new concern after seeing so many men in his family pass because of their heart issues. How the family risk hit Richard much earlier than he expected. That's Thursday at 8 a.m. A heart doctor and a nurse practitioner who works with people's hearts, keeping each other in a healthy rhythm. I'm Alexis Del Cid. Join me for a special All Things Heart as our week of Valentine's Love wraps up. What we can learn from a married couple working in cardiology. Lessons of how their love keeps the work-life balance. Friday at 8 a.m.